Hi, I'm Rosamund Dean, and tonight I'm delighted to be joined by Sarah Newman of Get Me Back UK, who you might have seen on, who you might know from Instagram. She is an exercise and cancer expert specialist. Here she is. I have to. I think she has to request to join, and then I'll add her in. And she, there we go, view request. Go. And she's a wealth of information, so I think we're going to learn a lot from her tonight. Hello.
Hello.
Hi.
Hello.
Hello, how are you?
I'm very well, thank you. How are you?
Good, thank you. Thanks
Good.
so much for joining me this evening.
No problem at all. Feels,
Um,
feels very different doing this on a Sunday night, but it's quite nice.
yeah, this is a nice end to the Easter holidays.
Yeah, definitely.
So, first of all, I'd love it if we could start just with you telling us a bit about yourself, about your story, your own diagnosis, and why you founded Get Me Back.
Yes. Okay. So sorry if you heard this one before, but so I'm Sarah. I was diagnosed with cervical cancer in pregnancy in 2018. So almost 5 years ago next month. And I was always a bit of a fitness fanatic. I loved exercising. It was something that made me feel a little bit in control of my body and my mind. And so it had always been quite an important part of my life. And even up until the point where I was diagnosed, I was still exercising. And then I got this diagnosis, and it was like, just stop, because the panic hit. And it was like, well, what if I'm damaging myself if I'm exercising? What if, I shouldn't be doing this kind of exercise? Even though I was 20 weeks pregnant and still exercising, that was okay. But it was a really weird, that had to be the first thing that went. So I got through kind of the weeks of diagnosis, waiting around for the scan results. And then once I knew what was going on, I decided that I had to do something to get the control back. So I went and park run a couple of weeks into chemotherapy. And then probably after that, that was about it. I didn't get much further than that. My treatment was very intense. It was kind of a combination of chemotherapy and radiotherapy together at the same time for about 4 or 5 months.
Wow.
So I was quite poorly. But at the time, probably like everybody else who was going through that type of treatment, but at the time I didn't feel like doing any exercise. But I did notice as I started to come to the end of my chemotherapy, and I think my chemo had finished and I'm still having radiotherapy, I noticed that if I'd got up in the morning, I'd feel much better and be able to do a lot more during the day. If I'd kind of got up, got myself dressed, maybe gone on a little walk or done something, I had much more energy. And so treatment kind of ended, and the first thing I wanted to go back to was exercise or feeling in control. And so I started to look into exercise classes. I couldn't find anything for anyone like me who didn't want to go to like a mainstream exercise class because it had been quite a traumatic experience, but wanted to do something as a group because I needed the support from other people. I needed the interaction.
Yeah.
So I actually ended up joining like a postnatal class. It was a women's health class, I say. There weren't babies there every time, but it definitely wasn't the right environment for me, having been through what I'd been through, but it felt like biologically I was working the right bits.
Yeah.
So I started to look into what actually it would take to become someone like, a trainer for people with cancer, because it was so important for me to exercise.
Yeah.
And I started looking into it, and then I started reading about the benefits of it. And actually, I decided that's what I wanted to do. So I spent the rest of my time off studying to become a personal trainer, and then always with the intention to go into the cancer world, and just continued my studies after I'd gone back to work and started the business, kind of working and studying on the job to become a cancer and exercise specialist. And that for me actually wasn't enough. I went on and did more studies because I really loved the breast cancer side of it. It was really interesting understanding, particularly in breast cancer, how movement can be impacted by all of the various different treatments. And as such a complex disease, it required a lot more knowledge. And so I spent an extra kind of bit of time just learning about breast cancer specifically and movement.
Yeah.
So within that time, I sort of started running the business, running Get Me Back. And it was lockdown that really just kind of was a big turning point for us, when everything went online and suddenly the business model changed. And the way that we worked with people, the way that we interacted with people became online, and I had to learn how to use Zoom. I had to learn how to teach classes online and to train people online, which is very different, not seeing them in person.
Yeah, of course.
But actually really, really loved it. And so that's kind of how it started and how it grew.
And that's so interesting, and so much of what you said is incredibly relatable to me, because when you go after having breast surgery, after having breast cancer, like you say, there's all the fatigue and the exhaustion that comes with chemo, then everything that comes with surgery, especially if you've had lymph node removal as well, all
Yeah,
the issues that can cause, and then radiotherapy and the kind of tightness and other issues that can cause. And then you go to a normal exercise class and they say, has anybody got any issues I should be aware of? And it's like,
how long you got?
how long have you got? Yeah. I'm there with my like lymphedema sleeve on and my like weird protrusion from my like Dieppe flap operation, and
Yeah,
just so many issues going on, and it's they're not going to be able to understand that. It's such a high level of knowledge you need to have to be able to understand that.
yeah,
So it's so amazing that you went into this world to do that, and especially because you mentioned the benefits of exercise for people with cancer, or people with and beyond cancer.
yeah.
So let's get into that, because the benefits are really quite astounding, actually, aren't they?
Yeah, and I think they're getting understood a lot more. They're getting talked about a lot more, even since I've been doing this job for the last 4 or 5 years. I mean, there is a huge benefit to exercising or being fit before your cancer diagnosis. I know you don't know when that's necessarily going to come, but even if you've got 3 weeks between your diagnosis and when your treatment starts, the kind of aim of the game is to get as fit as possible, and that mainly is cardiovascularly at that point. Walking, running, cycling, swimming, trying to get your fitness level up as much as you can, because you'll tolerate the anesthetic better, you'll recover faster, and you'll just be in better shape to be able to tolerate the treatment that's coming up.
And this is
Um,
not a thing that doctors tell you at all. So when
yeah,
I was diagnosed, I'm sure this is the case for everyone. When I was diagnosed, they gave me no information about that, and I was like, oh my god, I've got cancer, and I basically lay down on the sofa for pretty much for 6 months
yeah,
while I was
yeah,
going through all the treatment. I didn't do anything. I just thought rest is the most important thing, which obviously rest is really important.
yeah,
But in what ways would a bit of movement have helped me?
yeah. And you and me both. I mean, no one thinks you're going to put on weight when you have cancer. They associate it with losing weight. But I don't know about you. I put on, probably, I was the heaviest I've ever
Yeah, and this
been. By the time
steroids get
I
so
know,
fatty as well.
everywhere. So during treatment, particularly chemotherapy, that's where most of the studies have happened. The exercise is kind of a side effect reducer. So it can reduce the effects of things like nausea. Cancer-related fatigue, exercise has been found to be one of the most effective ways at reducing cancer-related fatigue. And that can feel really counterintuitive, because when you're feeling at your absolute most rubbish and you've been told you need to go out for a walk because it's going to make you feel better, you're like, really? But it does. But it's like a prescription, it is like a medicine, and what is right for you might not be right for me. I might need a shorter walk, you might need a longer walk, and what you've got to do is kind of find where that sweet spot is, because exercise during cancer treatment particularly is to tolerance, it's not to exhaustion. So you don't want to be exercising so you like collapse in a heap and can't do anything else that day.
Yeah.
You want to be exercising so you feel a little bit energized and a little bit more of a spring in your step.
Yeah.
um, so it's really important at reducing the side effects, but also, you know, the effects of steroids on muscle mass. I don't know about you, I just looked at my arms, and when I'd finished my treatment, I just had this kind of wobbly bit, and I was like, I've never had that wobbly bit
I mean,
before.
to be honest, I
Because,
had that before
well,
cancer anyway.
not maybe quite, not quite as wobbly, but you know, like, the muscle mass went really quickly with those steroids. So actually what you want to do during your treatment is maintain as much muscle mass as possible, and not just to support your bones and joints, but also what they're finding now is that your muscle tissue is actually much more effective at helping the treatment work. So the more muscle mass you've got, the more effective the treatment is going to actually work inside
So
you.
that's worth like really hammering home.
Mm.
Exercise during chemotherapy helps it work better. It actually
Yeah.
improves the efficacy of the chemo.
That's what they're finding in studies now, and also it means you can tolerate it for longer, because you know it's a hefty systemic treatment. It goes through the whole body, and actually the fitter and the stronger you are, the more likely you're going to be able to last longer using
Of course.
it.
And the less likely, I imagine, you are to have to miss or delay a session because your neutrophils are
Exactly.
not high enough.
Exactly. And that's a lot of what studies are showing now, is that people are staying on their treatment for longer. They're not having to miss sessions. They're also feeling better, living a better quality of life during their treatment, because they're reducing a lot of those treatment side effects.
Well, that's amazing.
I
And
know.
then further to that, beyond treatment, what are the
Yeah.
benefits of exercise in terms of if you've had successful treatment for a primary diagnosis,
Yeah.
and obviously your big obsession is reducing your risk of recurrence,
Yeah.
but how does
I mean,
exercise help with that?
the data around the risk of recurrence in itself is immense. I think there are some studies showing now, like, you can reduce your risk of recurrence by up to 50%. It's huge. The breast cancer studies, actually, some of them are even higher than that. So that's got to be the main motivation. But then there's your kind of everyday functionality. So thinking about how your joints might be a little bit more achy as a result of your hormone treatment or menopause. So exercise is really beneficial for all of those side effects of medical induced menopause. It also is beneficial at helping your heart recover. So there are quite a lot of chemotherapies that can be quite toxic on the heart. Mine was one of them. And so if you are starting to work on some of your cardiovascular function, so that's more the walking, the running, the swimming, the cycling, that kind of exercise is going to exercise your heart, and therefore improve the function of your heart and your lungs. The strength training is going to rebuild that muscle mass that you've lost. And at this point, when you finish your treatment, you can really start to think about how you progress that. And it's also going to help with your bone density. So now you don't have, if you've got a hormone driven cancer, for example, you don't have that hormone driving that bone strengthening. So you need the extra weight bearing activity, which is going to help keep the bones and the joints strong as you go into your medical menopause, or your menopause that you've already in.
This is a great point, because almost everyone who is premenopausal going into breast cancer treatment will be put into menopause by breast cancer treatment. Whether that's I was put into menopause age 40 because of chemotherapy that just like extinguished my ovaries. Obviously lots of women have, because mine was triple negative, but lots of women who have hormone receptor positive cancers have hormone treatment which puts them into early menopause. And or they might have, if they have a BRCA gene, then they might have their ovaries out menopause. There are many reasons, but lots of women will find that they're postmenopausal, maybe younger than they expected to be, and not really given any advice about how to help with it, and also told they can't have HRT, which has a protective effect on the bones and the heart. And exercise is one really proactive thing that you can do to kind of take control of that really shitty situation and actually really help yourself, isn't it?
And again, it is a prescription. Especially when a lot of people on drugs like letrozole, for example, or anastrozole, they find that their joints become really sore. So that's kind of a gentle introduction of exercise, getting that prescription right for you, so that you don't feel not crippled by it. So making sure that you're gently introducing it, it's benefiting you, it's not making you feel like you can't do anymore, but it is ultimately one of the best treatments for those side effects. And the hot flushes as well. Even though you get hot when you exercise, I think you manage to tolerate your hot flushes a lot better if you are regularly exercising.
And also, exercise has been shown in many, many, many studies to improve stress and anxiety. And both of those things are pretty high after cancer treatment, aren't they? And menopause can exacerbate that as well. So many, many ways it helps.
Definitely. Another great one is your bowel health. Sorry to start talking about poo so early on, but it does mean that exercise helps kind of keep everything moving, and you do store excess estrogen in your poo, so making sure that is expelled from your body. So exercising is a good way of keeping the bowels and the bowel health moving frequently, shall we say.
Good. Important. So let's talk about what obstacles people might face, because I know somebody watching this might be thinking, oh, for God's sake, I just can't. I mean, chemo, what do you want from me? I can't do anything. I can barely get out of bed. So what would be your advice to people that are feeling like the very idea of exercise is ridiculous at the moment?
Yeah, and I can totally relate to that as well. So there are some days where you just won't be able to do it, and that's okay. But you need to pick the time of day where you have the most amount of energy. So that might be in the morning or it might be in the evening, and that's the earmarked time where you want to be able to do a little bit more activity. And I used to use kind of meetings with friends as an opportunity to go for a walk. So we'd go for a walk, we'd have I don't think I was drinking coffee, but hot chocolate or something, and we talk, and that would get me outside, but it would get me that kind of 20-minute daily walk that I needed. And as the treatment started to wear off and started to finish, it got easier to do that walk. So that's one thing, is get your friends involved, make it a social occasion, fit it into the point of the day where you have the most amount of energy. The other thing is you've just got to do something that you enjoy. So whether that's dancing around the kitchen when you've got that most amount of energy with a load of friends, doing something at home if you don't feel comfortable going outside. There are workouts that you can do, walking workouts or more gentle based chair workouts that a lot of the charities have on their websites as well, just to do in the comfort of your own home. But I'd say trying to get outside is probably one thing I would recommend doing, particularly as the weather's starting to get better, because that is great for the mental health as well as the physical health. So just getting yourself moving gently and not doing too much that first time, just seeing what you feel comfortable with, and then every single day just increasing that by a minute or so, walking a little bit further, spending a little bit longer walking. That's a really great place to start. And I mean, that's the cardiovascular side of things. The strength side tends to be a little bit harder because it's scary and you might not have done it before, but that's kind of what I've tried to aim to help people with mostly, is the strength training, because that's where they get a little bit stuck. So and someone's recommended Move Charity, so 5K Your Way, Move Charity. Me and a load of other trainers have actually done some videos with seated and standard options for strength training, so you can use their website as well, and I've got some on my YouTube channel too. So really simple exercises, hopefully with good descriptions and introductions, so that you understand the exercises and why you're doing them.
And the joy of doing an exercise video at home is, if it's too much, you can just stop. You can listen to your body, see how you feel. Exactly. And that's the good thing about walking as well. As soon as you feel tired or weak, you can just go home. And also the other good thing about when you mentioned getting outside, I think it's good to mention that there is lots of evidence now that getting outside first thing in the morning is really good for sleep. And sleep is something that can really suffer during cancer treatment.
I think definitely getting some fresh air at some point during every single day, and it also is quite distracting, so it's you don't realize you've actually been out there for 5-10 minutes, and suddenly 20 minutes has passed, and actually there have been studies to say you work harder, like physically harder, if you go outside, because there are more distractions. But you also get your vitamin D hit, particularly at this time, or coming into this time of year. So there's lots of opportunities, and there's some really great charities out there as well that encourage it. So there's 5K Your Way. They tag on to Park Run at the end on the last Saturday of every month, and they encourage a group of people affected by cancer to walk, jog, run, or just watch the 5K route of certain park runs across the country. So that's a great way to get out with other people who are affected by cancer too.
Yeah, amazing. So let's be quite specific about what we should be doing, because when people say exercise reduces your risk of recurrence, I know lots of people say great, but what do I actually need to be doing? So what do they mean when they say that?
So the recommendations from the World Health, I'll get my words out. The World Health Organization, so big organization, are somewhere between 150 and 300 minutes of cardiovascular activity every week. So that's across the week. It does sound like a lot, but when you break it down across your 7 days, you're looking at around 30 minutes a day, or at least 5 days a week. And this can count as anything where you're raising your heart rate. So this is moderate activity. The more intense you go, the fewer minutes you need to do. So this is something like hoovering, walking at kind of a steady pace, so you're a bit breathy. You can talk but not sing, I think a lot of people say. Or you're going on a gentle bike ride or a gentle swim or something like that for 30 minutes a day. So if you have hoovered the lounge and then you walk up the stairs a few times and then you've got to go and do the school run, you've kind of ticked your 30 minutes quite quickly.
And it's good to say that things like that count, because I think people don't necessarily realise that.
They definitely.
I've got if anyone's got a fitness tracker, I've got an Aura ring, and when I hang up the washing in the overhead drying rack, it pops up on the app and says, "Have you done a workout? Log your workout." I'm like, I just hung the washing up, but you don't realise things like that do count towards it.
Yeah, definitely. And so the other thing that the World Health Organization recommends is 2 strength or resistance training sessions. So this is where some people can get a little bit stuck and think that they need to go to the gym and do some crazy barbell strength-based workout. No, you can use really simple things at home. If you're just getting started, you're worried about weight, I use a broomstick just to demonstrate some of the moves to begin with, and then you slowly start to increase your weight. And it's very, very simple movements that are kind of functional based movements, things that you use every day. So if you've ever heard of a squat, it is in theory getting in and out of a chair. That is the movement, but you just start to take away the chair and use your body weight. And then when you get a little bit better at that, you can introduce some dumbbells for some extra resistance, or something around like a booty band around your legs to work your bottom a bit more. But lots of different ways of using different pieces of equipment to focus on different muscles. And then things like walking up the stairs, that mimics, or a lunge mimics, the stair walking. So it's a bend in one leg and a bend in the other. It's a push through one leg to transfer the weight from one side to the other. So strengthening those knee joints, hip joints, everything, the muscles in between. That is one of those functional strength-based movements that you're going to be using on a daily basis.
So I think this is interesting to a lot of people, because I think many people think when you hear strength training, that involves some kind of equipment like weight, but it can literally be squats, lunges, movements like that.
Exactly. So it's any kind of exercise that's going to help you build muscle mass. So that can be using your body weight, but when your body weight gets too straightforward, you can add things into it, and it doesn't have to be weight, it can be resistance. So I brought with me my handy stretchy band. You can get some of these that are quite thick, and as you start to progress, they can get harder, and you can use them for almost everything, and they pack up into a small little thing, and you can stick it in your suitcase if you're going away, or staying away for a couple of nights. So everything's transportable. I did a 6-week program with just a band. So there's so many different exercises that you can do and still feel challenged with a resistance band. But things like bean tins, water bottles, I've had someone turn up with 2 bleach bottles at one point, but at least they were using a little bit of extra resistance.
A bit heavier than a bean,
bean tins, that's kind of a really good starter weight. But it gives you a little bit of extra resistance when you're doing some of these exercises. So we talked about like those functional movements, so that sitting in a chair, that squat based movement, that lunge based movement, helping for going up the stairs, but you've also got leaning forward to touch the toes or like pick something up from the ground. So a
Okay, the
hinge-based
hinge.
movement, yeah. So that is like a deadlift, a hinge. So you can do that on one leg or two.
Okay.
Really good at strengthening some of your bottom, your core, a little bit of back as well. But that is a really big movement that you probably do quite a few times a day.
Yeah.
Making sure you've got the form right so that you're using the correct muscles and the correct kind of approach to that exercise is really
Yeah.
important.
I was going to
And then you've
say,
got,
oh, sorry.
sorry, you go ahead.
I was going to say, should we demonstrate some? But we don't actually have much space, and there's
I know,
so
I
I'll
know.
just
I
say
did
that there
check
are.
whether I could get a bit
Yeah,
further out. I'm on a wheelie
right.
chair.
I mean,
But
there are loads of amazing videos
yeah,
on
so
Sarah's
the hinge here.
this
Yeah,
hinges like that
yeah,
at Get Me Back UK.
yeah.
Is it
On
on YouTube?
YouTube.
Yeah.
There's a whole strength training tutorial. So I wanted to make sure people felt comfortable doing quite simple moves like that, particularly with the deadlift, because that's when we can kind of round our shoulders for, the back can take over. So it's really important that one gets right.
Yeah.
But then you've got other movements. So you've got strength movements where you push the weight away. So an example of that is a press up. So that's a push of your weight away, or a push of weight above your head. And then you've got exercises where you pull the weight towards you, like a row. So a rowing machine, you're pulling the resistance towards you, and working the muscles that way.
Okay.
So really straightforward movements.
Now, is there what kinds of things should people be aware of after breast cancer? Because when you said push up, then that immediately made me think about
Yeah.
lymphedema. Because I know now if I do a plank, I've got to do it on my elbows rather than on my wrists. Otherwise, I get sausage fingers in my lymphedema hand.
I probably wouldn't actually be planking at all, even on your elbows.
Oh,
But I'm not sure. It depends. It's different people. You can build up to it. If you had that strength in the shoulders beforehand, I just don't tend to plank because I think there are alternatives that you can do to build up your core muscles.
okay.
Things like a press up, for example, take it easy, but you can use a wall to begin with. So
Okay.
you're not using your whole body weight through your shoulders. So you can press up standing up, and that just then reduces the amount of pressure through the shoulders. Or you can use this band behind your back and push
Ah,
the resistance away. So you're doing a similar exercise to work the chest.
okay.
So yeah, things to be aware of post breast cancer. You need to have the okay from your oncology team before you start, particularly strength training. So this is mainly post surgery, and it's around 4 to 6 weeks minimum that team will allow you to then start to move forward with strength training.
Okay.
Before that, you can walk and you can keep up your physio-based exercises, because what you want to try and do is make sure you regain as much mobility in your shoulders as possible.
Yes.
So other things to be aware of, I mentioned during the treatment chat about exercising, is that you're exercising for energy, not for exhaustion.
Yeah.
So you want to take it nice and slowly, because that energy will start coming back, but you want to progress at a steady rate. Don't immediately take yourself back to where you were pre-cancer. Work your way back up
Yeah.
there. See how your body responds each time you exercise. Remember, this is a prescription almost. So you want to leave a day, see how it goes, and then come back to it the next day. And
Okay.
then, as things start to get easier, you can start to increase weight, increase intensity, but wait that day, see how your body responds, and then move forward from there.
Yeah. Basically, listen to your body all the way
Exactly.
through. Is the key
Exactly.
takeaway.
And, from a lymphedema point of view, what you need to be aware of are the signs and
Yeah.
symptoms. So that redness, hotness, swelling, if something doesn't fit quite right, report it straight away, because the earlier it's treated, the sooner and the better outcomes that you will have.
Yeah.
So just being really careful. If you've had a full clearance, particularly, your risk is higher than somebody who might have had a couple of nodes taken. So making sure that you are avoiding exercises that are static holds. So something like a plank, be it on your elbows or your hands, is a static hold. For something that's more than 45 seconds to a minute, just be aware that you are putting a fair amount of pressure on your lymphatic system through that affected side.
Yeah. I
You
do.
can
So
build
I
up
now
to it.
wear, this is, I think, quite a good tip if you do have lymphedema. I now wear a ring on this hand that I never used to wear, because as soon as it starts to feel a bit tight, then I know that I need to, you know, drink more water, be moving my body, doing things like I've got this lymphedema
Oh yeah,
uh,
squeezes.
squeezy ball, yeah,
Brilliant.
that kind of thing.
Yeah,
So
and you must wear your sleeve when you
yeah,
exercise. So any compression garment needs to be worn during
yeah,
exercise.
yeah,
But yeah, so generally the rules are no static holds. So that's something that is for a long time you're holding your weight in your affected area.
yeah,
If you've got resistance band like this, I'd avoid wrapping it around your hand, just because that then again just puts a little bit too much pressure. Exercise for energy, and yeah, listen to your body. You don't ever exercise through pain. So if you
yeah.
feel pain, you need to stop and report it.
Good,
Um,
good question here.
yeah.
Can I ask what you think about downward dog if full lymph node clearance?
If it's something that you did pre-cancer, and it's a moving sequence of yoga poses, I think if you're moving in and out of it and you're not spending too long in the downward dog, you most likely will be okay. However, if you look up yoga for breast cancer, Marcia Mercier, she does some alternatives using the wall. So a bit like the press up, you're not putting your full weight through your shoulders. You've got an option for a wall-based downward dog, which would be less impactful on the shoulder.
Yeah, that's very good advice. And because I do love yoga, and I still go to yoga, and I still do downward dog sometimes, but now I'm just really, really aware of my body. And if it feels at all uncomfortable in my right arm, I just go straight to child's
Yeah,
pose. I don't care anymore. I'm not like, I've got to be the best. I've
no,
got to be like showing off in my downward dog. I'm just straight into child's pose.
yeah. I think as long as you're moving through the sequence when you're in it, and the pressure comes off the arm at some point within that sequence,
Yeah.
then everything is still moving. If you're in that downward dog position for a long time, I would definitely come in and out of it or use an alternative.
Yeah. Definitely. Well, thank you so much. I just realised it's we've been on for
Are we
30
still
minutes
talking?
already. Okay, there's one more question. How long is this advice for? And 6 months post lumpectomy.
Okay. So unfortunately, lymphedema is you're at lifelong risk once your nodes have been removed. So if you've had a few nodes removed, then you're at a much lower risk than someone who's had a full clearance. But you need to be aware of these signs and symptoms and take these extra precautions for moving forward. You can build yourself up so that your strength through your shoulders, through strength-based exercises, through those moving flow sequences to a longer hold, but that perhaps look into a few alternatives of things that you can do just so that you've got options, and be aware of those signs and symptoms of lymphedema just in case.
Oh. Well, thank you so much, Sarah. And just
No
before we
problem.
go, how can people sign up for you have an app and a membership platform. How can they sign up to Get Me Back?
So, so this week basically is the first week of my new membership, and it is an online membership specific to women who are recovering from cancer. So we run strength training classes 4 times a week. We have a yoga specialist, Marcia Mercier, who I mentioned, yoga for breast cancer. I've also got a physiotherapist, Hannah, who I think was watching earlier, who is a specialist oncology physiotherapist who's doing a clinic for us once a month, and a brilliant oncology nutritionist who's also supporting us with recipe ideas, a monthly Q&A and blogs and information that's all available online and via an app. So if you want to join, you need to go onto my website, www.getmeback.uk, and you'll find all of the information there. You can sign up, and once you're part of the team, you can download the app and watch workouts wherever you are.
Amazing. And then, like me, you can just stop them if it gets a bit hard. And then
No.
come back to the next day. Cool. Well, thank you so much, Sarah.
No problem at
Thanks.
all. No problem at all. Anytime, and any questions, just post them below and I'll try and answer them afterwards.
Thanks a lot. Take care.
You too.
Bye.
Bye.
Bye.